Welcome to the Disability News Report. I am your host, Jennifer Price. We're a month away from one of the fundamental rights each of us has, the right to vote. And while that right is important, voting does not come easy for everyone. Having a disability gives you a minority status that you can easily obtain at any point in time in your life. But what if you suddenly became disabled just before an election and were hospitalized? Would you know what to do about voting? How you could still cast a ballot? I'm talking to Oliver Tang, liaison to state election boards for the organization Patient Voting. Patient Voting focuses its mission on educating and simplifying the voting process for hospitalized patients. Oliver is going to talk to us about how that's done, as well as why all of that, coming up next. Welcome to the show. I'm here with Oliver Tang, liaison to state election boards for patient voting. Oliver, how are you?
I'm doing well today, Ms. Price. Thank you so much for inviting me here to talk about patient voting's work and emergency absentee voting.
Yeah, absolutely. So I just want to jump right into it, kind of piggybacking off of your last words about emergency absentee voting. How about we just start with you explaining what exactly is an emergency absentee ballot?
Absentee voting in general has, of course, entered the national discourse lately with things like COVID, just imagining how we're going to conduct safe elections in the fall. But another consideration that I think often escapes people until it affects them is that a lot of these absentee application deadlines within states comes days or weeks before election day itself. For example, our presidential election will be November 3rd, but the most common application to apply for an absentee ballot, the most common deadline to apply for an absentee ballot is actually a week before, the Tuesday before, October 27th. So let's say that I'm a voter who anticipates that I'm going to be at a polling location in person on election day, so I don't apply for an absentee ballot. But if something happens to me, like a medical emergency, a hospitalization, in that 1 week period between the deadline of when I'd be able to apply for an absentee ballot and when the presidential election would be, if I anticipate, for example, being hospitalized through all of November 3rd and not being able to go to a polling location in person, many states, 39 states, as well as Washington, D.C., in fact, actually have measures that kick in after a normal absentee application deadline that allows a voter during that sensitive period of time to request an absentee ballot due to something like a medical emergency and still be able to obtain that ballot and vote through it, despite this very unexpected situation that prevented them from going to a polling location on election day.
Okay, so you mentioned 39 states, but
Mm-hmm.
then insert patient voting, the organization
Mm-hmm.
for which you work, who helps patients to submit an emergency absentee ballot. So can you just explain what exactly does patient voting
So our work in patient voting is primarily informing the public about these processes and just making sure that we have a centralized resource to, I guess that's one of our goals, to make sure that we have a centralized resource informing the public about these processes. Among the 40 states that have such emergency absentee processes, we've actually found in some earlier research that we've done that it's really inconsistently reported online, like how each state's procedure works. We found that only around 75% of states actually have like a clear set of instructions on their websites regarding how to navigate their process. We found that probably a similar percentage of states only have an application online for patients to directly download. So as you can imagine, like being hospitalized is a very stressful process. There's so much for a patient as well as their family to navigate that we didn't want to add the added burden of a patient who wanted to vote having to figure out their state's process, however arcane it might be. So one of our goals is serving as sort of this centralized information source that kind of clearly breaks down how to vote, how to use a state's emergency absentee process. To this end, for example, for the 2020 elections, we're actually creating just like these very simple flyers just to outline the most useful websites that a voter can visit to see like where they have to deliver their application to, what means they have to deliver their application, things like that. So that is one of our goals. And I'd say another one of our goals is kind of serving directly as patient advocates if they were to decide to pursue emergency absentee voting. That might be asking a patient if they would like to vote in the first place, because I think public knowledge of these processes is very low. Patients might not even be aware that they still have this measure to vote despite the normal absentee deadline being over and despite being in their hospital bed. That might be many states' processes. I think at least 30 of them have rely on what is called an authorized agent for the voter, wherein the voter actually designates somebody. Some states mandate it to be a family member. Other states say it could be anybody. So it could be, for example, a patient's physician or nurse who just wants to advocate for them. The patient needs to dedicate an agent to essentially, in a way, ferry their application to their local boards of elections office, bring their ballot back, and then eventually return their ballot. So essentially, the agent does the in-person delivery work that the patient cannot do from their hospital bed. So part of our work is also coordinating the team of volunteers that is necessary to essentially serve as agents for voters. And then finally, it's more so just a miscellaneous, just logistical work that seems simple, I guess, from where we are, the comfort of where we are currently, but maybe extremely hard for a voter to navigate from a hospital bed. For example, something as simple as applications need to be printed out, but it's pretty hard to access a printer from your hospital bed or as a patient. We're just making sure we do things like mass printing of applications and things like that as well. So I think that our goals within this area are, one, just informing people, increasing public knowledge of these processes, two, serving as people's agents, and three, doing other things along the way to expedite the process, like printing out applications, because being hospitalized is a very complicated, very difficult time for anybody. So we just want to make this component of it, voting from your hospital bed, as simple as possible.
Okay, and so let's just look at some different states by way of example, because I imagine some states are a little bit, or make it a little bit easier than other states.
Yeah, I'm really glad to actually be discussing those three states specifically, because I think that they epitomize I think almost the canonical traditional way, that almost, I guess, the universal way that voting, that this emergency absentee process is conducted. So it will give me a really neat way to break this down step by step, and also to illuminate some minor differences between states on how this is done. So the first thing to be mindful of is just when does the normal when is the normal absentee application deadline for a voter in general? So in Pennsylvania and Rhode Island, this is October 27th, exactly a week before election day. Whereas in Rhode Island, it's a little earlier. It's October 13th, 21 days before election day. So in these three states, you have this period of time, 7 days for Pennsylvania and North Carolina, 21 days for Rhode Island, wherein if you're hospitalized during that time, it's too late to apply for a normal absentee application, for a normal absentee ballot, but you are still able to apply for an emergency absentee ballot due to processes available for this in all three states. So to break down how this process is first initiated, you would first download an application from that state's Board of Elections website. You fill out that application, you indicate that you're hospitalized, that's the reason you're applying for the ballot, and then you have to get that application to your county clerk or your local boards of elections. And the way to do this in Pennsylvania and in Rhode Island is to either designate an agent, which is what we talked about earlier. Say, I ask my sibling, I ask my spouse, I ask my parent to deliver this application in person for me to my local board of elections. Or you can mail it directly to your local board of elections. We recommend whenever possible that you find an agent to do so, but we also completely understand that some patients don't have a family member or someone to readily turn to as an agent, which is also why we want to inform people about things like being able to still send it by mail. In North Carolina, on the other hand, the only way to submit your application is through an agent. So you'll have to find an agent to do so. There's also on the brief topic of agents, there's also another thing to be mindful of, where states have different regulations regarding whether or not your agent has to be a family member or not. In Pennsylvania and Rhode Island, your agent can be anybody who is a registered voter, I believe. So if I don't have a family member, I can readily turn to someone from my healthcare team potentially, if they're interested, or someone from patient voting in this case, could act as my agent and deliver my application for me. On the other hand, in North Carolina, unfortunately, they restrict who you can be your agent to immediate family members. So that process is a little more restrictive. So I think something to keep in mind for this process is that there's a lot of interstate variation, a lot of little regulations to be aware of, but that's one. The
Right,
next
so
thing
that's
is
going to
that,
be pretty significant because when I hear that, I think that, North Carolina and other places in the South are already dealing with their suppression issues.
oh, well, my apologies, Ms. Price. So would you mind repeating that? I think the audio cut out a lot. So
Oh, I apologize.
yeah.
I was saying that
Hmm.
when I hear that it needs to
Hmm.
be your agent in North Carolina needs to be an immediate family member, that
Hmm.
draws memories of all the issues that North Carolina and other states in the South have already with voter suppression issues. And
Hmm.
so I think that just creates another barrier for for patients who are hospitalized because
Hmm.
if you're in the hospital and maybe you've developed a pretty good rapport with your nurse or a social worker or whoever could be visiting you, and that person is a
Hmm.
registered voter, if you're in Pennsylvania or Rhode Island, if I understand you correctly, that person could serve as your agent. But if you're in North Carolina, because that person is not an immediate family member, he cannot serve as your agent.
Yeah, I completely agree, and I think that this also it also is, I think, one of our other goals in essentially summarizing these universal, how the process works universally, but also these little interstate variations, is just showing these little things within the process that could be improved upon, because I think along the way they might make the process too unnecessarily difficult. And I completely agree that one of them is this regulation within North Carolina requiring agents to be a family member, as opposed to, as you had really just really, I think, hit the nail on the head for example, a physician, a nurse, a social worker that you happen to get really close to during your time of hospitalization.
Yeah.
And that's actually something I'm hoping to allude to when I finish covering the three states processes, because I think that Pennsylvania actually is an example of a state that has turned this around for the better. So I'll go into that real briefly once I'm done covering the process.
Yeah.
But so the mhm. Yeah. So the next step of the process is if your application is successfully processed, you need to obtain your ballot. So within Pennsylvania and so Pennsylvania allows your agent to return your ballot, or the Board of Elections might mail the ballot to your hospital bed. North Carolina asks for your agent to, essentially, they will turn in your application. If your application is successfully processed, they will bring the ballot back to you in your hospital bed. Rhode Island, I think, emphasizes a third approach of doing this, which I think is really interesting, which is Rhode Island actually has what is called a bipartisan in-person ballot delivery team, where essentially a local board of elections actually has a dedicated set of employees who they will send to directly deliver your ballot to you, to your hospital bed. It is bipartisan just as a measure to make sure that having one Democrat and one Republican within the team will ensure that there is no incentive against not ensuring that your ballot is returned back to your Board of Elections board, just that system of accountability. But I think that around 15 to 20 states, off the top of my head, have similar in-person team measures where you can actually request your local Board of Elections to send this team of local election workers essentially directly to your hospital bed to deliver your ballot to you. And I think the really neat part of this process as well is that once you've filled out your ballot, you voted your ballot, you just you give the ballot back to the team and they'll return it for you. That part of the process is handled for you through that in-person ballot delivery team. Mhm. But in the other two states that doesn't have these two teams, in Pennsylvania, the deadline to return your ballot is, I think, across the board, the deadline is always sometime in the afternoon of Election Day on November 3rd. So in Pennsylvania, for example, the deadline to return your ballot is on November 3rd on 8 p.m. You can do so through your agents or through mail. And in North Carolina, the deadline to return your ballot is November 3rd at 5 p.m. So you can do so by your agent or by mail as well. There's a lot of policies regarding your ballot has to be postmarked, your envelope has to be postmarked on this day and received X number of days after elections, and it's a really complicated. It's definitely a very that's definitely a very important thing to be mindful of when you're figuring out how to return your ballot if you want to do so by mail, because there it definitely is a lot of variation between states that definitely can't be cleanly summarized, unfortunately. So I think other things to be mindful of are, in some states, it's mandated to ask your physician to sign your application or to write out a statement under risk of perjury, just attesting that you are currently hospitalized, for example. So I think that is so a few states, I believe under 10, have this requirement. And while I understand the rationale behind it, just really wanting to ensure that voters, actually are hospitalized, I think that also presents an unnecessary barrier to the process for, say, a voter who's just, very overwhelmed by being hospitalized and doesn't want to ask this additional thing of their physician, for example. But that is some states mandate this, and that's something else to be mindful of. I think the second thing to be mindful of, and this has actually received more attention in the age of voting in COVID, is that some absentee ballots, this applies to all absentee ballots in general, including emergency absentee ballots, is that some, I believe 7 to 8 states, have rules mandating that an official notary, a public notary, or maybe 1 to 2 witnesses has to sign off on your ballot, has to witness your ballot being voted, and has to sign off on it.
That's significant.
Mm-hmm. Yeah, especially in, I believe, 3 to 4 states that mandate that it can't just be a witness, it has to be a notary, which is especially difficult to navigate because I imagine it must be pretty hard finding one from being confined in your hospital bed.
Yeah.
But I think that COVID's actually been raising some important conversations about this as well, in that you have a lot of, I think that the good thing is that I think a lot of these states have actually loosened their requirements for requiring a notary or witness signature, given COVID, how social distancing, how it's just so much harder to just find somebody else to sign your ballot, for example. But I think that a way that I think a lot of voter rights organizations have been going about it is actually creating these like witness drives where they have someone actually serve as a witness, for example, to a lot of different ballots, almost like a drive-in system or something like that. And I think that that's almost like paradoxically highlighted how unnecessary the witness signature requirement is as well. Because if anybody can theoretically witness your ballot, like why is it a requirement in the first place? Is a question that I sometimes ask myself when looking through these processes. But I guess outside of like making a statement on how these signatures are, that is just another thing for voters to be mindful of when it comes to navigating this process. But I actually wanted to go on Pennsylvania, one of the 3 states that we covered, because I think that they highlight something really interesting about how an emergency absentee voting process can be improved to improve turnouts. And this is something that has come across when I've corresponded with state election officials in the state. But prior to, I believe it was 2018 or 2019, when legislation was passed rectifying this, a voter's family or a voter's agent actually had to appeal the voters had to appear in front of the Court of Common Pleas within Pennsylvania, and actually had to get the application approved by not only the local elections board but also by the judge in their Court of Common Pleas. So they actually had to appear before courts and make the voter's case over why the voter couldn't vote on election day. Pennsylvania changed that system more recently. I think in legislation they passed in either 2018 or 2019, or where now actually a voter doesn't have to appear. That court requirement has been removed. All you need to do is deliver your application to your local boards of elections to get it signed. And in just lifting that simple process, in conversations I've had with election officials within Pennsylvania, they've actually said that turnout among hospitalized voters is actually increased pretty appreciably just by simplifying that process. So I think that another important thing is just getting the news out there, showing these barriers that might exist in the systems will hopefully encourage states to similarly streamline and make these processes simpler as well, just to so that we can encourage turnout, we can remove obstacles and suppression among hospitalized voters and improve turnout for these voters. And I think one last thing I wanted to note, the second thing is just that among the 11 states that don't have emergency voting processes, 5 of them are vote by mail. So 5 of them are those universal vote by mail states. So even within a hospital bed, there's still pretty good measures to reobtain a ballot and send it back. And in the 6 remaining states that don't have emergency voting processes, incidentally, I think the reason why that's so is that these 6 states, New Jersey, my home state being one of them, is that their normal absentee application deadline is either the day before election day or the day of elections. So there's this, there already is a pretty generous deadline, but there's still, even then, there still are a lot of measures like using an agent and in-person teams within these states, although they're not officially called emergency processes. Some of these states still have these measures to help voters that are hospitalized still navigate the process.
Okay. So they may not have an emergency absentee ballot process, but they have full compensated that by having a pretty liberal absentee voting process.
Yeah, precisely.
So at the end of the day, though, like we've been saying more than once, this is still voting. So do you see this way of voting or what patient voting is doing as being a form of healthcare advocacy at the end of the day?
I would definitely say so. I think that especially in COVID has definitely actually raised some, I think, soul searching within the medical profession regarding this. Whereas in the past, for example, it might be seen as unprofessional for a physician to talk openly about their political views, for example, things like that. But I think that seeing COVID, how things at the governmental level, how a government's response to something like a pandemic actively impacts the health of our patients. I think there has been this turnaround in thought, especially emerging, wherein I think physicians are realizing that I think number one, that just registering a voter, just registering a patient to vote or helping a patient vote isn't intrinsically a political or a partisan action. We're just helping, in my view, for example, I think that we're just helping a voter access just this basic right that is available to them by being an American citizen, for example, just the right to access democratic participation. A medical emergency shouldn't separate you from that. And I think number two, I think that also I definitely would view it as a form of advocacy in that there are so many upstream factors, upstream socioeconomic, political, environmental factors impacting a voter's health outside of the hospital walls. And a concern that a lot of physicians have is that often a voter's disease, a voter's condition is more a byproduct of these upstream factors as opposed to things like any biological factors, for example, or they're exacerbating these factors. For example, anyone with a chronic condition, for example, diabetes. There are so many socioeconomic factors like, the cost of accessing insulin, for example, having a good support system. So many other things beyond the biological factors will impact how you will fare with this disease, how you will navigate this process of having this chronic condition. And I think that a lot of physicians have this worry that often we're addressing the biological needs of the patient, but we're returning them to these harmful upstream. We're returning them to back to these fundamental, harmful upstream political, socioeconomic, environmental factors when we return them back home without helping them navigate these processes as well. And I think a remedy to this, a cure to this, is helping voters access the ballot box so they can play a more active voice in shaping the policymakers who influence these upstream factors as well.
Yeah, absolutely. I totally agree. I mean, and the patient voting organization was founded by emergency medicine resident Dr. Long.
Mm-hmm.
She's resident with Brown University. You currently are a medical student with Brown University. How do you see, or do you see, that you guys and other people like the other med students and doctors are particularly situated in a special way to help elevate the voices of patients who are hospitalized?
Mm-hmm. So I think that definitely a lot of actually leadership on the end of voting rights has been done within the realm of emergency medicine. The folks at the front line caring for physicians who may acutely admitted to an emergency department, such as Dr. Kelly Wong and her work founding patient voting. And I think that it actually it's no coincidence in that I think the emergency department is this perfect confluence of these factors of one, patients who are ending up within the hospital who hours earlier would not have anticipated this. And number two, Dr. Wong has mentioned to me before that her experience founding patient voting was actually grounded in her early experience in a residency caring for patients in, say, the 2016 election, who actually from the hospital bed cited these concerns of, I want to vote in the election. Like I don't want to be hospitalized through November 3rd. And sometimes it would come to the point where these patients would leave. The medical jargon for this is, quote, against medical advice. These patients would actually leave the emergency department just to make sure that they could still cast their vote. So I think you see this perfect confluence of factors where you have these voters who are acutely impacted, I think, by these socio-environmental, these socio-political, these environmental factors, and you have voters who are just you have these voters who are unexpectedly ended up in the hospital. So I think a lot of things converging to encounter a lot of patients who would have otherwise a lot of patients who would have otherwise a lot of patients who express a lot of interest in still being able to exercise things like voting. I think that another trend is, and this was actually written about really well by a New York Times article by Farah Stockman, who actually interviewed Dr. Wong, as well as another voting rights organization called Vote ER, that is run by an emergency physician called Dr. Alistair Martin. Is that there is another, I think, conceptualization arising called "quote unquote" social emergency medicine, which I think alludes to some of the themes that I talked about earlier, in that our traditional conceptualization of medicine and a physician's role is taking care of the voter's body and the physiological and the biological ailments impacting them. But I think that gradually over time, and I think COVID has especially shown this, is that our role as physicians, I think, also extends arguably out to being advocates for our patients as well. Things like unsafe neighborhood conditions, advocating for things like food security and housing security, which I think undoubtedly impacts the voter's health. Just advocating for, I think, upstream factors impacting a voter's health, and helping connect voters and helping empower voters in these processes as well, such as connecting them to a ballot. So I think that's another way that I think I see how my interest in patient voting initially arose, and I think an impetus that is driving a lot of these organizations, such as patient voting and Vote ER.
Well, and so let's talk about that. I mean, what did get you interested in the issue of patient voting?
Mm-hmm. So my interest in patient voting initially, so I joined near the beginning of the year. I think that I also went through this similar process where I spend many hours in medical school every day just learning about the human body and disease. But when I go into the impact, when I go into a mentor's clinic, for example, I just see so many other factors impacting a patient that it feels like healthcare, that our limited conceptualization of healthcare is doing, could do a better job of addressing things like things like patients citing insurance concerns as to why they delayed seeing a doctor over these symptoms that were later discovered to be something like a tumor, for example. Things like a voter expressing concerns about just like voters expressing concerns about things like patients expressing things like food security and things like that. So I wanted to also, I think, step beyond my training to also, I guess, advocate for my surrounding communities as well. Just I think that there's more I can do as a future physician to help out my patients and the underlying communities that they belong to. So that's why I joined patient voting, and I think that seeing everything that's been going on amidst COVID has really reinforced, I think, the importance of the work as well, in that how our patients fare is not just a byproduct of what doctors do with our own hands. It's also very much a product of things like good governance, good policies. And I think that in seeing a lot of what has gone wrong with our federal government's response to COVID, I think that has also reinforced my belief that I also need to advocate for patients outside the conventional realms of what we call medical care. So that's what drove my interest in patient voting.
Is it so? Where are some of the goals, or where is the future of patient voting? Whether you were forecasting 6 months, 1 year, 3 years out, what do you see as some of the future goals of patient voting?
Yeah, so I think I see our fundamental goal as having a network of volunteers and advocates within all 50 states and within as many hospitals as we can, and just to serve those fundamental purposes we discussed earlier, things like informing the public of these procedures in general, serving as things like agents when a voter's family cannot or a voter has a hard time finding them, and just handling these other logistical tasks, like, say, printing out a ballot for something as simple as printing out a ballot that might be really hard from a hospital bed. And to that end, we're actively recruiting resident physicians and practicing physicians across the country. I think that we're primarily I think, a volunteer-based organization where we have a lot of volunteers who may serve as the lead for a certain state or the lead of a certain hospital, just coordinating this process for a hospital. And I think also just incorporating this into into a hospital's daily process of care. Something as simple as a physician might not normally think to ask a voter hospitalized in early November, ask a patient hospitalized in early November, are you interested in voting, for example? But just making sure that we have advocates actively incorporating this into processes of care of a hospital. And so to that end, we've, especially in the time of COVID, we've been seeing a very big surge of interest in new volunteers, whether they be medical students or practicing physicians, signing up to serve as the lead for their hospital, for their state. We've seen things like medical student chapters being established. So I think that our goal really is to really, I think, grow and spread at the community level, especially because, as we talked about earlier, even within 3 states, there are so many different nuances within each of these 3 states processes. So I think that having people working on the ground, attentive to their local community's needs, is really our big goal in patient voting. And so just growing our volunteer base to do so, I think, is our primary goal.
All right, and all the change of patient voting. Thank you. I appreciate it.
Yeah, thank you so much for your time as well, Ms. Bryce. We can also be reached at patientvoting@gmail.com if you ever have any inquiries as well. Even if anything like just if you are a hospitalized voter and are unsure how to navigate the process, feel free to send an email. We always have representatives reading the email, ready to respond to you.
Very nice. And the website is patientvoting.org.
Yes, patient voting. Yes, and we can also be found on social media as well. So we can also be found on Twitter. So yes.
Thanks, Oliver.
Yeah, no problem.